you are one of the millions of parents searching online, looking up pediatric chiropractic, and just wondering where you should take your child to, who to trust, what is the difference between this type of chiropractor and this type of therapy, this video should help explain a little bit about the different types of chiropractic care and what you want to be looking for if you're looking for your child. Thankfully today we are in a time where things like pediatric chiropractic care isn't so taboo and it's not unheard of. Even a few years ago, if you were to search pediatric chiropractor, gluten-free, dye-free, all of those things just were not as mainstream, weren't as talked about as it is today. And so there's so much more information online that you can find about healing therapies for your child and other modalities you might use or detoxes that you might look into for your kids. And so when we're talking about chiropractic care specifically, we are really talking about trying to get down to the root cause of what's going on in the body. A lot of pediatric offices in the more mainstream medical system tend to prescribe drugs first or look at the symptoms and not really figure out what is going on or why it's going on. And so chiropractic in general has tried to look at the nervous system, which is pretty much the first thing in the body that controls everything else. And so looking at that, we can kind of see where are things going off the rails, where are they going offline, how can we get our bodies working better and properly, and so from a neurological root issue place. So when we're looking at chiropractic, we really want to focus on that our office is a neurologically based chiropractic office, and that just means that we're really focused on achieving neurological stability because that is what's introduced in the body first. And so if we fix the neurological piece, we are going to then see more progress with other therapies. If we don't do it in sequential order, like that sequential approach, we're not going to see as much benefit because the nervous system is the basis, the foundation of all other bodily functions. And so if we don't address the nervous system first and we add other therapies in first, sometimes we're clouding what's actually working and we're not getting to that base of stability before we add other therapies in. So looking at different types of chiropractic care, there are pretty much three main types of chiropractic, and one is going to be that traditional musculoskeletal chiropractic care that most people are familiar with or have seen videos about or watched TikToks of, but that's really focusing on musculoskeletal areas like things, like adjusting back pain, neck pain, spinal problems, using a lot of spinal manipulation adjustments, we don't say cracks, to relieve pain, increase mobility. And so when you go to a traditional chiropractor like that, you might also have things like massage, rehab, postural correction, ice packs, different modalities that are going to help the muscle and skeletal system as well. Obviously great for so many people, athletes. A lot of the general public needs their pain addressed, and so it doesn't always get down to the neurological imbalances, however. So the next is something called functional neurology. So a lot of people are becoming familiar with this type of brain-based therapy that really is stimulating the brain and trying to balance how the brain is working. And so it includes a lot of sensory stimulation and cognitive exercises to really work on that primitive integration of the brain, the reflexes, which we do some of that once we start our care with primitive reflexes, but not to the extent of eye movements and lights and all of those things. So this could be amazing for people. It just tends to be very multifaceted, very intense, and a very overwhelming approach, if that makes sense. And then last but not least is more of a neurological based chiropractic care model. So that's what our office does, is we are really focused on getting to the root cause, which is subluxation, then nervous system dysregulation, and then the dysfunction and dysautonomia that comes from that. So we really use specific neurotonal adjustments. It's a little bit different than a normal chiropractor's adjustments. We do neurotonal adjustments to really restore the balance in that nervous system. We really want to use our scans and see what's going on in the nervous system and then have an individualized care plan for each child or adult based on that, and really work on the function of the body, not just the symptoms of the body. Again, what sets that apart is really trying to achieve that neurological stability before we're introducing other therapies. We really want to make sure that the nervous system is healthy before anything else can be added on. And so when looking at the kind of the science and the research with that, we really want to focus on that central and autonomic nervous system because that's the first thing that's going to get thrown off track. And so sometimes we see other symptoms and think that means this is going on, but that foundation, that central nervous system is really the base, and so we have to address that. And so then once we start seeing the subluxation, sympathetic dominance, all of that setting in, then we already are like kind of going in motion. And other things can contribute to chronic illness, but it's not the true root cause. So when we look from subluxation to sympathetic dominance to nervous system dysregulation, we sometimes see things like decreased gut immune function, different microbiome issues that you're looking at, lowered motility, absorption. Elimination is a big part. We're seeing delayed or missed milestones, and that can be gross or fine motor milestones that we're seeing that. And that means things like delays or missing, things like rolling over to both directions, belly and back, and then sitting up, crawling, not crawling properly, 2 hands, 2 knees, more like the walking early, walking late, talking, jumping before we start walking, jumping before we start climbing. Those are all kind of issues that throw our nervous system off, but our brain balance off as well. And so then we kind of look at the retained primitive reflexes and the tongue or oral ties. We call them tethered oral ties. But when those are present in the body, we're seeing a lot of other things too, but the root cause is still nervous system imbalance. So all those other things can happen, and they can come from subluxation and sympathetic dominance, but it's not the cause. It's the chicken and the egg, which came first. The subluxation of your nervous system came first. And so that's what we really want to address. Now, when you're looking at different chiropractors who do neurologic type care, there are other differences between them too. So our office, all of the doctors are certified in something called the Webster technique, which is more prenatal focused, not necessarily in line with what we're talking about right now. But we also have other training in more pediatric realms. So the ICPA, which is a very, very important and well-known organization, we have lots of extensive training through them, lots of seminars through them, testing through them, and then the pediatric experience is the other really big, important one that we love to talk about. PX is definitely something that we are really focused on in our office and have had really great success with kids who are diagnosed or not diagnosed with things like ASD, OCD, ODD, anxiety, etc., etc. We're really seeing huge changes because of the way that they approach pediatric care and that neurotonal, neurofunctional type of care. And so all of our doctors have attended seminars from them, trainings from them, certifications from them as well. I also am focused certified, which is another set of certifications to do with how the brain's working, how the brain's balanced, really focusing on that neurological piece for kids. And so when you're looking for a pediatric office for your child, you want to make sure that it's not an office that sees the average person for musculoskeletal things and then sees kids. You really want to make sure it's someone who truly is seeing kids. That's their bread and butter. That's what their certifications are in. When they're doing an exam, they're looking at the entire body. They're checking all of the things that affect the nervous system. So the more certifications, the more letters behind someone's name, the more time and effort and energy someone has put into getting pediatric care and certifications, the more knowledge they have to give you, to give your child, to help them down the road. So it's definitely important to not just find a chiropractor who says nervous system on their website and sees car accidents, whiplash, neck pain, sciatic, and kids. You really want to look at someone's website, look at these different directories online, whether it's pxdocs.com or icpaforkids.com, and find someone who has taken a lot more time and has built a lot more skill in seeing your pediatric patients. If you're going to trust your kid with them, especially to get to the really root level of what's going on in their body, you really want to make sure that this person is very highly trained and that is what their sole focus is. So I hope this answered any questions for you. If you're looking for a chiropractor, you can check out those websites I mentioned, or you can DM us, comment, and we can help you find someone in your area, or call our office and get started here.